Hi. Thanks for allowing me this chance to talk with you today. My name's Anna Willats, and I'm a professor in the Assaulted Women's and Children's Counselor Advocate Program at George Brown College. I've worked with women's organizations and advocates in this city for about 30 years to ensure that all women, including undocumented women and those with precarious status, have access without fear to the services and supports that they need to protect themselves from male violence and to rebuild their lives. And I'm going to go off my notes a little. I don't want to be too repetitive. People before me have articulated really well what challenges women face. I just wanted to say I'm speaking in wholehearted support of the Access Without Fear recommendations that are in front of you from the Access Not Fear Sanctuary City campaign. I want to really emphasize how important it is to adopt all of them as opposed to picking from some of them, and I'll tell you a little bit about why. Just yesterday afternoon, I attended a forum on the U of T campus sponsored by the Rights of Non-Status Women Network. And at that forum, several presenters who work with refugee women and undocumented women talked about the fact that their workers within the community services and social services sector are finding that they're experiencing a great deal of distress, burnout, guilt, because they haven't got places to refer women. They are having women come in their doors, women without status, refugee women who are experiencing trauma here in this country, as well as the trauma that has caused them to leave their home countries, and they haven't got places to refer them to. That's why it's so important for us to have a city audit and a look at all of the city-funded services, making sure that they have Access Without Fear policies, making sure that all of the staff within those services understand what that means. Sometimes you do need to ascertain somebody's status to make sure that you're making the right referrals, but what people talked about yesterday was that there's a real lack of constancy and continuity in terms of what's available. So it's really important that workers know where they can send women, because what's happening is a few workers are dealing with an awful lot of people, and it's becoming very difficult for them. Another presenter reported on a recent immigrant and refugee women's programs needs assessment. It was conducted by Springtide Resources with service providers, peer educators, and key informants who work with undocumented women. They found that 49% of those respondents identified lack of training as a barrier to providing services to women in these situations. They identified a lack of information and knowledge about services and resources, a lack of funding, resources, services, and cultural awareness as additional barriers they face when providing services. They talked about the need for agencies to establish firm and accountable policy positions on immigration-related issues so that workers have the background and analysis they need to offer effective and relevant services to undocumented women. And they talked about other things. So again, this just reiterates why these recommendations are so important, and they are supported both from advocates and activists in the community. They are also supported by workers within agencies and services. You heard earlier from Natisha Massaquoi about the health problems that being in this country without status or just being a new immigrant can cause. And the lack of consistently delivered social services and barriers to access exacerbate those problems. So that speaks to the kind of issues 1 and 2. I also want to say how important it is for this city to take a strong stand in advocacy with the provincial and the federal governments. And people, again, have talked a little bit about why, but I'll just raise a couple of examples of why it's so important to not only have Access Without Fear at the city level, but also to be going for that and really advocating for that at all levels. We've talked about the fact that women who experience violence or people who are witnesses to crimes who are undocumented or have precarious status cannot approach the police or feel that they cannot approach the police because they are fearful of being reported to Immigration Canada and of being deported. This means that the police do not have all of the tools that they need to solve crime. Often the police complain about lack of cooperation from some communities. This may be some of why they have lack of cooperation, is that people who witness these kinds of things, and let's face it, the more vulnerable, the more hidden, the more invisible people are, the more likely they are to be a victim of crime. And there's lots of research that shows that. And so what we're doing is we're getting in the way of police being able to do their job, and we're also getting in the way of women being able to protect themselves from violence, keeping them trapped in their homes. And with your indulgence, I'll just talk about one more example. In emergency rooms and in healthcare facilities, nurses are now regularly screening for domestic violence. And this is a wonderful thing that's happening. But if those nurses and those healthcare facilities are screening, but do not have an understanding of the needs and the vulnerabilities of people who who are undocumented or who do not have status, then that means that women who experience violence are going to avoid those facilities because of fear about deportation. So you can see how it all snowballs. And so it can't be at just one level. It has to be at all three levels. And our mayor, I know, has a strong personal relationship with the Prime Minister. They go fishing. Perhaps they could put this on the agenda of their next fishing trip.